In this video, we'll show you how to raise a mucoperiosteal flap. We begin with an envelope flap designed for minimal access to the crest of alveolar bones surrounding a tooth. Using a scalpel, run the blade along the point where the tooth meets the free gingiva to release the junctional epithelium. The angle of your blade must be parallel with the slope of the crown at the point where it meets the free gingiva, so that the blade enters the sulcus cleanly to make the cut. This is the same angle that you would use for BPE probing. Hold the scalpel like you would a pen for the best dexterity, and a finger rest can also prove useful if you feel unstable. Try and follow the contours of the tooth closely so that the cutting edge separates the gingiva cleanly from the tooth and alveolar crest. Your blade should always be reaching down to bone when you make the cut. I then take the sharp edge of the Mitchell's trimmer to gently check if all tissues have been released as we expect. A gentle probe in the free gingival sulcus reveals all the tissue reflecting nicely. I then switch to the spoon end of the Mitchell's trimmer to start to raise the flap. The spoon should always face the tooth and bone, with the sharp edge engaging the bone in order to release the periosteum layer. Downward scraping motions with firm pressure towards the bone will start to peel and deflect the gingival tissues. Try and work across the entire length of the tooth to give laxity throughout the entire flap. Otherwise, you risk tearing the flap if you push too much in one area whilst the rest is still very adherent. This is especially important for patients with thin gingival biotypes. Notice how I'm holding the Mitchell's trimmer like a pen with a finger rest applied in order to maximise my accuracy. With a degree of pressure being used, it is easy to slip and cause trauma to the surrounding soft tissues, so care must be taken. Once the flap has sufficient laxity across the entire length of the tooth, I switch to the Howarth periosteal elevator to raise the flap further. This instrument is broader, so works more effectively when you have sufficient space for it to be introduced. The technique is the same as with the Mitchells. Gentle twisting motions can also help at this stage if the periosteum is proving to be very adherent. With the envelope flap complete, we can see the alveolar crest where it meets the tooth. When we require more access, we can convert the envelope flap into a two-sided flap. To do this, we make a relieving incision which includes the papilla. Relieving incisions should be cut with a slight angle such that the base is slightly wider than the margin of the flap. This is to ensure sufficient blood supply for healing. Keep the belly of the scalpel firmly against the bone and carefully slide the scalpel down into the buccal sulcus, taking care to navigate to the curvature of the alveolar bone. The mucosa will open up once you cut past the mucogingival junction. You can use the sharp end of your Mitchell's to score this incision that you have made in order to ensure that it is fully released. Then, using the spoon end of your Mitchell's trimmer, proceed to release the papilla. You can start doing this either from the top of the flap or at the base of the incision where the alveolar mucosa opens up. Aim to take the periosteum with the flap. You can then use the Howarth periosteal elevator to release as you have done before. You've now raised a two-sided flap. As you can see, it provides great visual access compared to an envelope flap. To turn this into a three-sided flap for maximum access, perform the same procedure on the opposite side of the envelope flap. Ensure to include the papilla with the incision so that it gets reflected away. Cutting into the papilla risks gingival recession in the healing stages. Use an instrument to stretch the mucosa so that the scalpel cuts most cleanly. Again, use a combination of the Mitchell's trimmer and the Howarth to score and release your flap. At the end, you should see a pale underside to your flap, indicating that the full thickness of the mucosa has been released. This will maximise blood flow to the tissues in the healing stages and minimise scarification. You have now successfully raised a three-sided mucoperiosteal flap and are ready to perform surgical removal of the tooth.